Omuka so omubeyi me banani ne de eye mawreho mesu yankasa se mekasa mansu ana meboa.
2-year-old Herbert and 6-year-old Kobna have cancer. They're total strangers who have been united by a disease. It's 8 a.m. and their mothers Lordina and Esther ready them for the day. Ideally, they should both be going to school, but they're heading to the cancer daycare unit at the Kolebu Teaching Hospital in Accra. They have spent most of their time there for the past 1 year. When Herbert was 6 months old, his mother noticed his eyes were severely jaundiced.
Eya na ye yellow by anopa unhu awiamu san unhu gise anumbre na ubehu se sai ade no ewo nani no left no na ahode ni ho nti me kotwen wo fie kakra ansa na eye ya na me baaye ti sese me baaye no na omoka kire me se me ba no nani no senete no omubeyi.
At just 2 years old, Herbert has gone through several chemotherapies and other treatments which led to his left eye being taken out. He now wears a prosthetic eye. Like Herbert, Kobna has also gone through months of chemotherapy and a surgery to remove his kidney. It was after he was diagnosed with what medical doctors call Wilms tumor, a cancer that affects the kidney.
Doctor's room I'm catching like one year and cancer. Na affecting the kidney back the right one. We so cancer the anka the minimum anka penny when you monya pension near the end. Omunanka saya nanka mama anka nusa akola ketu akwa timinya cancer.
These mothers have had to stop working to cater to their sick children. They spend all their time at the hospital. Some of their friends and family have stepped in to take care of their 3 other children. Nana Kobna and Herbert are 2 of the 1,200 children and adolescents estimated to develop cancer in Ghana annually. However, experts say out of this number, only about 400 cases are seen across all the treatment centers in the country. This is largely due to late reporting and detection. Cancer is the leading cause of death worldwide. The World Health Organization says about 400,000 children develop cancer every year. Dr. Lily Gloria Tego is a pediatric oncology fellow at the Kolebu Teaching Hospital. She says, although over 95% of childhood cancers cannot be linked to a particular cause, over 75% can be cured if it is reported early and gets prompt treatment.
When they come or the symptoms start, some would have gone to the pharmacy shops and started off from there. Some would have gone to the herbalist and started off from there. Or some just ask their other friends and relatives and are like, oh, take this herb, and then they go ahead and take it for as long as they can. Some would also go to prayer camps and whatnot. That some would actually go to a hospital and probably have been told, oh, you have to go to Kolebu or Konfanochi or wherever, and they're like, oh, I don't have money.
Doctors say the drugs for chemotherapy affect normal cells as well as cancer cells and parts of the body where cells multiply quickly, such as the lining of the mouth, gut, and hair follicles. And that is exactly what is happening to Herbert and Kobna. It can cost between $1,000 to $7,000 to treat childhood cancer, an amount beyond the means of many Ghanaians.
First in there, me botre ofena me ton indomie so by say me wa ase no ni nyina me si me nya hwe biom o frafia sometimes be fresh ampa no ba peke obo on say o fre no oni say sika sem tina o fre ni tina o fro bia tam o pe na be oba fro oba peke uko open so on feel kra.
For the first time in Ghana, children diagnosed with cancer are to receive care through the National Health Insurance Scheme. This will cover the diagnosis and treatment of 4 common childhood cancers: acute lymphoblastic leukemia, Burkitt lymphoma, retinoblastoma, and Wilms tumor. Dr. Tego is optimistic this will encourage more people to seek early treatment.
It hasn't fully been implemented yet because there are still works that have to be done on the ground. So right now it's still a bit of the status quo, even though it's just starting with 4 and they have no idea of whether their child's cancer will be part of the 4. At least that would drive people more to come to the hospital. So we'll see how it goes after it's implemented, and then looking forward, then comparing it to what has been happening to see the kind of impact.
Another concern is the lack of adequate specialists for childhood cancer in the country. Currently, Ghana has only 6 specialists. Back at the hostel built by the Rebecca Foundation for Children with Cancer at the Korle Bu Teaching Hospital, where the family lives for free during the duration of the treatment, the mothers dream of reuniting with their families soon. For doctors like Dr. Tego, sending children back home once they've finally been declared cancer-free provides a great sense of fulfillment. She remains hopeful that Herbert and Kobna will soon be able to beat the disease. For GH1 News, Nadima Umar Uthman, Korle Bu Teaching Hospital, Accra.